So first, you do 4 years of undergrad in the field of your choice, usually biology or something, healthcare focused. And then most PA programs are anywhere from 2 to 2.5 years. Ours here in New Orleans was 29 months. First of all, tips that I can offer would be to be interested in the field, obviously. Being a PA, you go through very quick schooling and a lot of the things you learn on the job. So you don't learn them in school like a lot of other things. You just kind of get a base, and whatever you do on the job, you learn there.
Yeah.
So experience for people that are interested would be following a PA, shadowing a PA, doing healthcare related work, being very familiar with medical terminology, the way hospitals and doctors' offices and things like that work, because that's something you don't really get a lot of exposure to until the very end. And it's something that looks really good whenever you're applying to PA school, if you have a lot of experience. So PAs work in all different fields. I'm specifically outpatient, and I work for gastroenterology. So I am specifically clinic-based, meaning I work a pretty nice Monday through Friday, 8 to 5 schedule, seeing patients in the office. I don't take any call. I don't do any procedures in the hospital. I don't follow any hospital patients. Luckily, I'm part of a practice where we have team physicians that manage patients in the hospital and do procedures, so that's not really a part of my job. But I know other GI PAs and other PAs in different fields that do hospital work or things like that. But for me, the schedule is nice because I'm Monday through Friday office job, off on the holidays, nights, and weekends. So typically on a normal basis, I see patients normally 50 and older, most of the time referred from their primary care provider for either screening colonoscopies or straightforward GI complaints, whether they have blood in their stool or abdominal pain, nausea, vomiting, diarrhea, constipation. I see young people as well because we treat specifically inflammatory bowel disease, so Crohn's disease and ulcerative colitis, and that is a disease that affects a lot of young people. So I kind of see a broad range, no pediatrics, so starting at the age of 18 and on, and mostly referred from their primary care. Okay, so my favorite thing about my job is watching people progress and get better with any complaint that they originally come to me for, and then if I follow them through, it is nice to see them be appreciative of how they're feeling and watch them go from feeling poorly to feeling great. My least favorite thing is a lot of times we have to fight with insurance companies to get patients what they deserve, and so that's really frustrating because patients don't always get what they deserve. In the clinic, we have doctors, NPs, nurses, MAs, all levels, phlebotomists, kind of work with a whole range of people trying to get patients taken care of and get what they need done. The biggest thing that distinguishes PAs from MDs would be our flexibility in terms of field. So when we go to school, we get board certified generally throughout every specialty or primary care, and we can flip-flop and switch, so we're not married to one specialty. So where a doctor gets trained and picks one field and has to go back to training to pick another field, we have mainly on-the-job training, so we get to just flip. I could change that I don't want to be in GI anymore and do, sports medicine or something like that, and just is the job that matters, not the training. Possible work settings for PAs, you can do outpatient clinic like I do, emergency room, inpatient hospital, whether you're a specialist or in hospital medicine. Basically anywhere that you see a physician assistant can be. We can be in surgery. We work really well with surgeons, orthopedic surgeons, general surgeons, colorectal surgeons, plastic surgeons. We have the ability to be first assist in surgeries, so that's why we're very appealing to surgeons, because we can see the patients in clinic and then we can start the surgery, like make the opening wound and close the wound without the physician being in the operating room, so that's really nice, and then assist them throughout the entire operation. In the emergency room, we function basically similar to a physician and see patients, so that increases availability for medical professionals. And then in my favorite realm, the clinic, seeing our own patients and increasing the practice's volume of patients just by having a second provider to see patients. So the biggest common misconception that I get, and I think it's mostly because I'm young, is that everyone thinks that I'm a student or that I'm a resident. And even when I say PA, they still question me, thinking that I'm a student or a resident. And I have to quickly tell them that no, I'm the real deal. Also, they think that physician assistants cannot work by themselves in terms of seeing a patient by ourselves. So yes, we are supervised by physicians, and I do run my patient cases through my supervising physician when I have questions and those things. But we don't have to have a physician in the room with us when we see a patient, and we can write our own prescriptions, order our own diagnostic tests, interpret those tests, and diagnose and manage patients all on our own. So when I see a patient, I care for the patient myself with the help of my supervising physician, kind of from an external standpoint, not necessarily on top of everything that I do. Average salary for a PA is anywhere between $75,000 to usually $100,000 to $125,000 a year, depending on field and experience. So the PA profession is only growing as access to healthcare increases through financial or insurance ways, and through our aging and growing population. PAs have a really helpful spot to be in, being a mid-level provider where we have less training and less overhead and more time sometimes. So to be licensed in the state of Louisiana, you have to get 100 continuing medical education hours every 2 years. And then you certify. So initially, whenever you graduate, you take your certification board exam, which is a 300-question exam. And then we recertify every 10 years, which is a board general certification, so it's not specialty specific. And everyone has to do that every 10 years to keep your certification, and then the CMEs are every 2 years for 100 hours.